Hi. First of all, I would like to say that my heart goes out to all people all over the world who have been, in one way or another, dramatically affected by the spread of the corona COVID-19 virus. Whether it's through loss of loved ones, through loss of health, and you're struggling with you're battling the disease, you're fighting the disease at this point in time, whether it's because you're taking care of loved ones around you in the hospital, whether they're in the hospital or at home, financial loss, etc. It's a very, very stressful time, very, very challenging for many, many people. But the reason I actually decided to make this video is for those people out there, perhaps it's you, who are still physically healthy, who have thankfully not have to cope with losing someone else or etc., but who can't handle the stress of it all mentally, basically. Because there are a lot of people out there who are consuming so much information about the virus at this point in time, stuck glued to their phones almost, or their laptops, or their televisions and their radios, but who have a hard time processing it in a what you could call, or what I would call, healthy way mentally. So, for example, I know a person who has been so stressed out by the whole situation, but is still healthy, has access to food, has a home where this person can stay in, which is more than a lot of other people in this world have, basically, when you think about it. But who has been so stressed because of all of it and all the information, reading too much, etc., that this person was shouting on the street to other persons who were not maintaining the required social distance. So I can understand where the stress comes from. I really can. But I strongly believe that that is not what we need right now, added to what is already happening, because it's causing more conflict, it's causing polarization, and basically adding stress to the stress that is already out there. So that is not good. So I'm really hoping that people who are struggling with processing all the information that is out there will limit their intake by a lack of words, lack of other words, of that, and try to find ways to relax a bit more. And thanks to the World Wide Web, and many of us have access to that, there are so many things we can do to try to relax and to for example, take a yoga class online, ballet dancing, write poetry, take a vocal course, etc. There's so much we can do. And we're lucky, the lucky ones, because there are a lot of people who can't do those things. So we should count our blessings as well and try to stay as calm as possible. I personally have not lost at this point anyone to the virus, so I'm very grateful for that. I do, however, have two parents who belong to, both of them actually, to the highest risk category because of health issues and also age. And on top of that, one of my parents is struggling with dementia, with a form of dementia. And as many other people who struggle with dementia and who are not in a home, due to waiting lists, etc., whatever the reason is, or there are no homes, etc., it's very difficult because people with dementia might not always understand what is going on, fully comprehend what is going on, and are not always able to assess the risks they are taking. So they might be taking risks that are not smart, basically. And it's very tough, not only on the professionals around them, but also for family members like myself. But we still have to try to remain as calm as possible and try to be positive in this situation as much as possible. Of course, we're all human beings, so we all have our emotions, but we need to try to stay as calm as possible, because otherwise there's going to be so many other conflicts arising adding to the stress again. Also, I would like to explain that is the reason why I decided not to, for example, write a lengthy piece on my personal frustrations, on, for example, how governments are handling the situations. I could have done that, and I do have a lot of personal thoughts on it, and I'm following a lot of the international research, but I've decided not to because I feel a lot of information is out there for those who want it and who feel that they can process it mentally in what you could call a healthy way. But I do not want to add to the stress to those people who are reaching their max, or who are already feeling a lot of mental stress because of it. So a big applause for anyone who's taking care of anyone, whether you're a professional working in healthcare or you're taking care of family members, children, parents, siblings. It's a challenging time, very challenging time, and I hope you take care of yourself as well. Bye.